much so that we now are about to launch a strategic plan for the department that he has helped to lead, that he has been a major factor in leading. And also, just a matter of days ago, we found out that our Department of Parks and Recreation here in the city has been nationally accredited, which is really a wonderful accomplishment. Just in the event that you are wondering, there are only 4%, I think, of our between 3 and 4% of our departments of Parks and Recreation nationally that actually are accredited. So we are a very small number in rarefied air, and now that we've achieved that, we intend to keep it there. This is the first time that we've had an event like this in the District of Columbia, and it is wonderful to see so many people who come out to be a part of this, because it is a discussion that I won't say is long overdue, because it probably has gone on in some places on some occasions, but it really hasn't been done in this way in the District of Columbia. So let me thank each of you for taking the time to come out on a Saturday and participate in this conversation about mental health. We have an audience today, we have a group of people today, and you're going to spend your time working, not listening to a lot of people, but you're going to spend your time working. But this is a group that doesn't necessarily always come together to be able to address these issues. We have people here who are personally touched by mental health issues. We have people here who are part of a family, who may have a family member who is touched by mental illness. We have people who provide services to people who are grappling with mental health challenges. And of course, we have advocates, and advocates have helped to make a tremendous difference in this arena and so many others in the District of Columbia over the years. Just so it's clear, we have 30,000 people in the District of Columbia who use our public mental health system. And that is huge, not uncommon for cities of this size and complexity. And then we have others who use private insurance, and of course use private physicians. And when you look at the work that's been done over the years, and I want to personally thank, there's so many people to credit, but I want to thank Steve Barron for the work Steve's done. I want to thank Steve for leading the effort. Actually, it wasn't that long ago that the District of Columbia was able to extricate itself from the Dixon case, a case that had been around for almost 40 years, back in the early 70s, back when we had a hospital, St. Elizabeth's Hospital. It was a public hospital run at the time by the federal government. Then in 1987, I think it was turned over to the District of Columbia. And then all of that time, the community mental health system was run by the District of Columbia. We had this bifurcated system that really didn't work well for lots of people. So the work that was done by Steve and those working with him got us to the point where we managed to extricate ourselves from that case. But, you know, we need to look at cases like that as designed to really include system operation, systemic services. And so even though we're out of the case, that doesn't mean we're out of the woods, because we have a lot of work to do. As a matter of fact, we just launched, not even 2 weeks ago now, our new Department of Behavioral Health, because we recognize that there's so many instances in which people have a co-occurrence of mental health challenges as well as substance abuse challenges. We had substance abuse treatment and prevention in one area of the government, and we had mental health in the department unto itself in another part of the government. And it just seemed to make sense to bring those things together so that we could bring those people who have the experience of both, to bring them together so that we can make services more efficient and hopefully more effective as well. So Steve is leading that new Department of Behavioral Health, in which APRA, which you're all familiar with, and the Department of Mental Health have now been merged into one department. I do want to thank the President. Back in January, he was the one that called for a national conversation on mental health issues. and rightfully said that we must bring mental health out of the shadows. You know, what's really sad is that for those who are not around the problem, people often think of, and some of that's been unfortunately perpetrated, reinforced by media portrayals, etc., portray mental illness as characterized by violence, and that is absolutely untrue for so many people. You go back and look at an Alfred Hitchcock movie many years ago, Psycho, where everybody remember that? Like, I think it was a remake of it recently. And then you look at so many other situations, not the least of which was just recently at the Navy Yard, where we had somebody who obviously was delusional, somebody who was mentally ill, who engaged in the violence of using a gun because he felt he was being stalked. He obviously was mentally ill and shot and killed 12 people. But that is not the image of mental illness that really is accurate. Sure, those things happen, but they probably are such a small fraction of the experiences that we have that we need to focus more of our energy on people, the dominant number of people who really are not violent, people who oftentimes themselves are victimized. How many people have we seen on the street in the homeless population who we know are mentally ill and wind up homeless because they have problems with mental health and don't know how to access the treatment or don't have people who really know how to reach out to them and make treatment and services available to them. So that's why today is so important. One of the major objectives of today is to be able to leave here with a framework of a plan of how we go forward. How do we put services together? How do we do more, for example, to put services in our schools so that children who may be starting to be at the edge, we recognize them early enough to be able to intervene and do something from a prevention or early intervention perspective rather than waiting until treatment is necessary. And we know treatment works, but it's a lot more difficult to address that problem when somebody is in need of treatment rather than something that can be prevented. We have now in the District of Columbia, we have the most robust early childhood education program in America. We have 92% of our 4-year-olds who are now in school. We have 70% of our 3-year-olds. We have established an early success framework. Hastings and I were just talking about a grant application that we are submitting that we think we will be very competitive for with the Department of Education that would allow us to look at the needs of children from the time they're born through 3rd grade. And that is such a critical developmental period. And don't you think, ladies and gentlemen, to be able to embed in that effort a focus on mental health services, as I said, mental health services, not mental illness services. Mental health services will be an important contribution to being able to move our city forward, to assist our families, and to be able to make sure that our children have the best opportunity possible to be as healthy and successful and happy in the city as we possibly can. We are a growing city. We have now 632,000 people who live in the city, which, by the way, is larger than the state of Vermont, larger than the state of Wyoming, and we are growing every day. And with that growth comes complexity. And with that growth comes challenges that otherwise might not exist. So you are at a historic moment. You are at the point where you can really help us build upon what has occurred in the past, the things that we've been able to be successful at, but then how do we go forward? How do we move this city forward in a way that says we recognize that a mental health challenge is an illness, is a challenge just like anything else, and illnesses can be prevented, illnesses can be treated, and people can recover. That is the kind of optimism and forward thinking that we want to bring to this effort today. So I want to thank all of you for coming out. I was afraid that I would come today and see Steve, that there would be 50 people who were here, which would leave me very depressed because it would suggest that maybe people don't understand fully the importance of this. But when I look out here, I see hundreds of people. I see hundreds of people who care, people who have a role in one way or the other in being able to address this problem. people who are very, very skilled in helping us to be able to get the best information and ideas possible out of folks. So please join me now in welcoming the folks from America Speaks, who I've worked with, have enormous respect for, know the great work they can do, and know the great ideas that are out here that have been brought out as a part of this session. Please welcome Steve Brigham and Matisse Haynes.